Hello there, warm good afternoon. I'm Dr. Anuj Sathe. I'm a consultant cardiologist at Apollo Hospitals, Navi Mumbai, Belapur. Just wanted to stress a few points. These are troubled times. We are facing the COVID-19 pandemic. As you all know that COVID-19 is due to this new virus which is circulating in the community, which belongs to the SARS coronavirus family. What we know is that it primarily affects the lungs and the heart. The primary target, of course, is the lungs. Only when there's severe involvement of the lungs, when patients present with breathlessness and have low blood pressure, then the chances of their heart being involved is very high. The mechanisms are probably unknown, but what we know is either the body mounts an immune response, and this immune response can be a catastrophe in terms of that it involves the heart and it also involves the lungs. The second probable mechanism of involvement of the heart is because of direct infection of the heart muscle by this dreaded virus, what we call as myocarditis. So either ways, the presentation is often florid and often some dangerous manifestations that one must know about. What we know that there are two basic issues here when we talk about COVID-19 and the heart. The first subset is generally the elderly people, the old subset, with some underlying comorbidities and underlying heart conditions, what we call a structural heart disease. They are the ones who are predisposed to the manifestations of this virus via the immunological pathway. So this can present as people who are already on ventilators, having a lot of breathlessness, their BP is very low, and that is when the heart is also affected. The pumping of the heart reduces and they go into what we call as florid congestive heart failure. So this particular modality is what we see generally in the elderly subset, and those with underlying structural heart disease, they also have comorbidities, and this is the most common. About 80 to 90% of the patients that we see belong to this subset. The second subset that I would like to talk about is the young patients who often complain of chest pain. Of course, they do have breathlessness. They are infected with coronavirus 19 infection, and generally it's the virus which directly infects their heart muscle and what we call as myocarditis, that is a direct infection of the heart muscle. About 10% of the people, usually the younger people, will present in this way. This is the basic pathogenesis of coronavirus, COVID-19 virus affecting the heart. Now, what is also important is that the presentations could be either in the form of heart failure, it could be in the form of a heart attack, what we call as acute coronary syndrome. And what are the symptoms leading to it is generally full-blown shortness of breath or the typical anginal chest pain that we have. So these are the two symptoms that one must watch out for, and please consult your physician or a cardiologist if you happen to observe these symptoms. Who are likely to manifest these dreaded complications are generally the elderly subset, as I already told you, with known comorbidities. They are the ones, or often those people, elderly subset, who are already on ventilator, who have a cytokine storm. They are very, very, very likely to have heart involvement and the dreaded complications which we were just talking about. So the exact pathogenesis may not be known in a particular subset, whether it be the immunological response which is damaging the heart or direct heart muscle. In any case, what we need is to be watchful and try to prevent this coronavirus infection. And how do we go about things is by wearing mask, maintaining social distancing. Now, with the positivity rate very less in most parts of our country, we are allowed to move about. So there is no restriction per se to stay at home only. But then you should make use of sanitizers, face masks, and follow the social distancing norms. They are extremely important not to catch this infection. However, in the event you do observe certain symptoms like shortness of breath or chest pain, typical anginal chest pain, you must consult your doctor. Go to the nearest hospital. A very good point is that we are very glad that Apollo hospitals are carrying out a lot of research activities, the immunization schedule, not only on an individual basis but on the population basis as well. So a lot of people stand to gain a lot of positives from Apollo hospitals, not only treating the patients but also trying to prevent the infection and trying to vaccinate the general population as well. Please understand that you must continue with all your heart medications in the meantime. Do not stop any of your medications if you have undergone a bypass surgery or an angioplasty. do not stop any of your blood thinners or statins or your BP medications. One mention should be made that ACE inhibitors and ARBs, there was some concern regarding these medications if they were in enhanced susceptibility to COVID-19 infection. As of date, we do not have any evidence that any of these medications increases the susceptibility to COVID-19 infections, or you are likely to face more complications. No, that is not on the cards. We do not have any evidence. So please continue with your medications, whatever medications you are currently taking. Before stopping any medications, if you feel that there's some side effect of the medication, please consult your physician or your cardiologist at the earliest. You must understand this is a very stressful time, not only for me, all the healthcare workers, all the people around me. It's a very stressful time in terms of getting upset emotionally as well as mentally. So try to maintain contact with your peers, try to maintain contact with your friends. May not be in person, but at least on Facebook, Twitter, or whatever social media platform that you're using. You must try to communicate with your fellow beings, your friends, your family members who are not with you. This will help you to keep mentally sound, and also try to exchange ideas, to promote new thoughts, and basically to remain healthy. A very important point one must note is that get yourself vaccinated at the earliest. So we at Apollo Hospitals here are also providing a very comprehensive vaccination package that we have started, and you stand to benefit from it as well. We have taken the vaccines, why not you? Please get vaccinated with whatever vaccine you choose. It may be Covaxin or Covishield or Sputnik for that matter. Please get yourself vaccinated, because prevention is better than cure. We all know that COVID-19 can manifest in a variety of ways. You do not know the fate. The destiny is in your hands. So get yourself vaccinated. Continue with all the medications that you have. Try to lead a healthy life. Eat a balanced diet. Exercise. Go for walks. Try to keep your weight under check. And try to do all the positive things whatever you can. If you are an ardent yoga or a meditation fan, please practice yoga. You can double the time you spend doing yoga or meditation. But these are the only ways by which you can probably try to win over this virus. There are no particular medication or no drug of choice as of now which is set to cure COVID-19 infection. So till that time, till we find that wonder drug, I think vaccination is the only way to go about things. New researches are on the horizons. We probably find newer breakthroughs are probably on the cards. But till that time, we have to wait and we have to practice what I have already preached. And this is probably the best way to go forward. So if you have any symptoms, as was before, it is now. Chest pain, shortness of breath, or anything that you feel you are concerned about your own health, please consult your physician or the cardiologist at the earliest. Thank you.